Well, hello again. It's Pauliano here from Tangmere Dental Care near Chichester. I've been doing some tests in relation to trying to figure out the fallow time, or how quickly aerosols settle in a dental surgery, and then combining them with various mitigating features. It did seem to make sense because obviously there's a lot of talk in relation to the actual aerosol generated by dental equipment, to see what sort of readings I get with my particulate meter here. So I'm actually going to be trying to create aerosol. I've got my Piezon set up here. I've got a turbine set up with a big burr, which as the water hits that, it does spray more. I've also got a Cavitron here as well, and then of course finally the triple syringe with using air and water together is considered to be an aerosol. So I've got the particulate meter at roughly my working height here. Now I've got water with some antiseptic in it to make sure that it gives measurable readings. That's in the cart, and it's also in this dish which I've got with natural gnashes. And because I don't want to actually cut my my plastic teeth, I've got a few teeth here that I actually have practiced on in the past, which I can actually put the instrument on in real world usage and see what actually happens here. Okay, so I'll do each bit of equipment first. Let's start with the triple syringe. And of course we do get a bit of splashback, so I'm actually going to just going to pop on a surgical mask so I don't get that splashback, because even if it is clean, I don't particularly want that. So we'll have it really quite close to the meter and we'll have a little look. So we're going to just blow with air, and of course we get these big droplets coming back. And we've all had that spray come back and it hits you in the visor, and of course it's not particularly pleasant. And I've always thought that even if you've got your safety specs on, it can get past. So the visors these days actually are rather good, and I have had a few splashbacks which have been caught by those. But let's just carry on here. So I'm trying to generate an aerosol. Just occurred to me that maybe I should start the timer on how long I'm doing this for. So start there. Obviously we're not getting many readings at the moment. I'm getting a little wet here as well. So I hope you guys can see that. Obviously it's spraying everywhere and really giving it a good go. Probably going to keep all of these going for a minute. I'll probably speed this up in the video. We're actually getting splashes onto the particulate meter here. Really trying fairly hard. Get this so it's almost in a position whereby I would have, if my face was here, then I'd be having my face actually in the patient's mouth. Yeah, okay. So in reality, in terms of measurable particle sizes, we're not getting any readings with the triple syringe there. Let's just stop that and then reset. And obviously I've only just finished. I mean, there's no real fallow time here because we're not getting any sort of really fine particles that are rising up, and everything has come back down to normal levels really instantly, if they went up at all in the first place. Okay, well I'm just going to get a bit of tissue because we've got water everywhere. Okay, well obviously I've got splashes on the particulate meter, so I'm going to need to wipe that or stop that or reset that. Okay. Right, okay. Now on to the next one. Right, okay, well that's interesting. We have I just paused there where I was actually going to be changing on to the next one, and we have got just start that again. We have got a little bit of an increase of particulate readings after having used the triple syringe, which seem to actually come into effect. Now let's move the air around a little bit here in this area. It did seem to go up there just a little bit as I was actually trying to get everything ready. Now I've actually moved my arms around, everything seems to be settling back down again, so let's just stop that. Right, okay, so I've cleaned things up, got rid of all the water splashes, and we're going to go on to the next one, which is going to be a Piezon scaler. I've set the water up reasonably high so that it's again trying to generate some sort of aerosol. And of course you've got to remember here that we've got no high volume suction in effect. There's no cheeks around here, so that would catch some of the aerosol generated. So let's just see if you can sort of see that we're getting a decent spray from this. I'm hoping that that's visible. What I'll do is I'll start this again, possibly keep it going for longer than a minute. And again, I'm going to sort of get this spray right up close to the particle meter. I'm getting a few splashes actually onto the base of the particle meter here. So I'm going to keep this going, actually trying to generate an aerosol which you know, would give us some increased readings. Okay, I'm going to pop this down actually into the water. So we've got that's fairly difficult to do. Let's just hold that there. There we go. So the tip is basically submerged, saying that when it's submerged it actually generates less aerosol. And again, really trying here, so I'll hold this up, generating that sort of fine mist. And we are again, the same as with the triple syringe, we're really not getting any increased readings here at all. Which again is interesting. So again, I'm just, you know, literally right up here trying to move this around in the area of the meter, sort of seeing if we're getting anything coming back. I suppose if the patient coughed, that would be a different thing, but you know, if we're using barriers or other mitigating things, the isolight's particularly good. Been using that for a few years, and that's excellent even for a hygienist, because you can flick that round left to right, and you can do an entire half of the mouth at a time, and you know, with that in effect, you know, the patient's not going to be able to cough either. So again, we've had so I'll stop this. I've kept going for over a minute really, just having the timer on there for some sort of reference, but it has not increased from really significantly from our baseline measurements there. Right, so next one then, next bit of kit is the Cavitron. Again, going to set this fairly high so that we get a water mist. Let's turn that on so you can see here we got a fairly good water spray going here. And then what we're going to do is I'm going to try to hold this up, actually scaling around some real teeth in this kidney dish here, and I'm going to raise that up a little bit with it going, and we'll go into an area where the tooth is subaqua to actually simulate some saliva in the mouth. And as I said, this has got some antiseptic in it, so it should be giving measurable readings, and I'll try and demonstrate that later, that this isn't just the fact that the reading, the meter isn't actually reading this. I just think that the droplets that are generated by our equipment are bigger and are falling very, very much more quickly. So again, with the Cavitron here, let's raise this up. Okay, start the time. Stop that. Stop and reset. Go. Okay, so let's try again here. Obviously, I was going to use the timer to try and time how quickly the readings drop, but because they're not going up, obviously in a way the timer is actually irrelevant. I'm forgetting to zero it, but as I said, so far that's not really relevant. So I'll keep going, try and actually get some readings, and let's pop that down there. Let's waft around a little bit and see if that has an effect. Not really. We're staying really very, very good air quality readings. So let's stop that, reset that. So okay, on to the final bit of kit, the turbine. Again, water levels are, let's turn the Cavitron off. Water levels have been set relatively high, so we're going to get hopefully a decent spray back here. Again, I'll show you that. So we've got a good amount of spray here, and I'm going to raise this up fairly close to the particle meter, and I've got an actual tooth in there, so I'm actually going to do that. And I think you can see the turbine, without anything to catch that, with a big bird, is actually kicking up a lot of spray. Now I think that actually goes to prove that the particle meter is actually reading there. We're going up to 220 over 200 on the lower PM 2.5. Of course the PM10, which is a slightly bigger particle size, and of course we don't know what viral load is required, or what particle size is required for enough viral load to actually transmit coronavirus. It's thought, a cough or a sneeze is required for big droplets, but in my mind, people seem to be catching this up, very easily. And if you actually breathe onto a pane of glass in the winter and you see that condensation, I don't know really whether the very tiny particles from breath before they've actually evaporated could be a cause of transmission. I mean, it is a theory. I mean, we've just got to assume that all of these particle readings there are going to potentially transmit coronavirus. Now that went up quite high, and it has actually dropped, irrespective of not stopping here. But I'm going to really sort of give it a go, get quite close. So I would be having my face here literally in the field of action. We are going up to, yeah, there we go. You can sort of see, you can get it up to 200, so that's 300. There we go. Okay, now I'm going to stop the aerosol generating procedure, and here this comes into effect. Let's see how long these particulates take to fall to reasonable levels. Let's just straighten that up a little bit. So we haven't had any suction at all. There's not been the high volume suction, that we have here. Obviously the nurse would normally be holding a sucker on here and sucking that away. And obviously, as I said, there's barriers. You could have rubber dam, you could have the isolite, and there are the other things that we're going to be testing. The LEV systems, the local exhaust. LEV. Oh, I forgot. The local exhaust ventilation system, and then also turn those off. And then also we've got the air purifiers that will filter the air and make the air nice and clean in the first place. Okay, well we've seen really that that the scaler, the triple syringe and the Cavitron didn't seem to produce this particulate that flew up. The turbine with a big burr on it, you know, yes, we did get quite substantial readings. So that proves that the antiseptic in the water does actually measure, so that validates the fact that the scaler and those other things, you know, are probably not as bad as we thought. This now we'll just wait and see. So I'll speed the video up on this one because the particulates are taking a reasonable time to fall from this. Right, okay, well, we're some 7 minutes in here, and I can see my battery on my camera is starting to go down, so we may well be just relying on the GoPro in a minute, where the battery is a little bit better. What I would say is that the PM10, which is the larger particle size, has stayed relatively consistent at just over 20 micrograms per meter cubed. Now, of course, those are the bigger ones that may well be more likely to contain sufficient viral load to actually infect a person. There we go, there we go. That's it. It's actually hit just below the parts per million of 10. I think my GoPro just conked out with the battery there, but let's just bring this in, and we've got the time. I'm hoping that captured it. Oops, I'm hoping that captured it to the very end, but we are looking at 45 minutes. Now that's wow. I mean, I just would not have believed that. I mean, you know, okay, yes, there's nothing else here, and I really tried to get the aerosol into the air, and we are looking at, if you know, at that hour's fallow time pretty much, if you don't have anything else in effect. at the end of the day, the thing is here that we have got to stay safe, and we don't want to be coming back into a surgery within at least 3/4 of an hour. So thank you very much for watching, guys. It'd be interesting to see if the GoPro just conked out at the last second there. That would just be typical. But yeah, well, thank you for watching, and you know, subscribe, hit that like button and the notification bell, because very soon I'm going to be introducing or testing those other methods to try and make sure that we don't just have to rely on PPE and then the aerosol settling. So thank you very much for watching, guys, and until the next one, take care. Bye.